So hello guys, welcome back to Barak official channel. In case you are new here, remember to subscribe, like and share so that we can hit more subscribers as we're going to shoot more videos. So today we are going to do a health educative talk, and today guys I have a new guest. He's a student like me but he's doing clinical medicine. I will give him time to introduce himself. Niaje bro?
Niaje, poa sana bro.
Yeah.
Okay, so my name is Chalo Ngirwach. I'm a clinical medicine student, 2.1.
Yeah.
Thank you so much.
So guys, I heard this Charles is a upcoming doctor, the doctor himself. So today we are going to talk about pneumonia. Tunaenda kuongelea about pneumonia, which is a condition that actually like inadhuru maisha watu wengi kabisa. Watu wengi wanakufa juu pneumonia. So today me and Charles host hapa tuongelea about pneumonia, how is pneumonia brought about, and what is pneumonia, and what are some of the complication, madhara ya pneumonia, ile ambayo inafanya watu wana succumb to death, ndio. So Charles, so what is this condition known as pneumonia? What is it in terms of definition?
Thank you so much. So pneumonia is a respiratory condition because in the body we normally have 11 to 14 systems.
Yeah.
And one of them is respiratory system. So pneumonia is basically a respiratory condition that is brought about by the microbes, microorganisms, when they are inhaled through the anatomy, through the trachea, the bronchioles, up to the secondary bronchioles, and then they inflame the alveoli. So inflammation of alveoli is basically what we are terming as pneumonia.
Alveoli, I understand, ile inasaidia gases exchange. So in
yes.
case it could inflame, then that's how pneumonia
That
occurs.
is how pneumonia occurs.
So guys, kama umeelewa, that's the definition of pneumonia. So we're going to go about straight to the point. What are some of the causes of this pneumonia? Or like because I understand they have different types of pneumonia. So I just want you to brush through some of the types so that tuangalie the causes of pneumonia, sindio? Yeah.
Thank you so much. So pneumonia is basically classified into according to 3 parameters. One is according to the site of the lungs that is affected. So in the anatomy of the lungs, we normally have the interstitium, the bronchi, the lobes. So from the lobe we have the lobular pneumonia. From the bronchi we also have the bronchopneumonia. Then we have the interstitial pneumonia. So from those names, that is the respective anatomical sites that are affected by the microbes.
So that's the location.
That's according to location. Now according to the source, now the source of the pneumonia. Now we have community acquired. Community acquired is basically caused by, general community, community health, interaction of the even kids at school, pollution of air, that is community acquired. Villages. And then when we come to now the hospital setup, that is where we get the hospital acquired pneumonia, which is medically referred as nosocomial pneumonia. So in the hospital setup, you find patients maybe they are, the
like
interval,
like walikuwa walitreatiwa but due to the long stay in the hospital, ina predispose to
other conditions,
hospital acquired pneumonia, sindio?
True.
Yeah.
And then again we have also aspiration pneumonia. Aspiration is basically what you take in through the noses. So like for example GERD, there is a condition called GERD, that is gastroesophageal reflux disease, where the gastric contents, the gastric contents vitu yenye kwa stomach, fluids. So when they are being ejected outwards, they are being now aspirated through the epiglottis.
So the content in the stomach zinatoka na nje.
Yes,
like zinarudi nje tena.
Zinarudi nje.
Esophagus.
And then zikirudi nje kwa esophagus, inaingia through the epiglottis, inaingia trachea, and then inaenda kuinflame the alveoli.
Like someone anakuwa na hiccups hivi.
Yeah, such things. So basically those are ways in which, again, the last is according to the causative agents. Now we have different causative agents. We can have viruses, we can have bacteria, we can have the fungi. So for the case of bacteria, we can have Streptococcus pneumoniae. That is a gram-positive bacteria. We also have Staphylococcus aureus. For the case of viruses, we have the H. influenzae. We also have, for the fungi, we have Histoplasmosis, Cryptococcus neoformans, and such. So that those are the causative agents, bacteria, small microorganisms that are found in the community setup.
Okay.
Thank you so much. Those are the classifications of pneumonia.
So pneumonia, I understand, for the friends who are watching this video, how different type, we have different classification of pneumonia. Vya ameongelea kuna hospital acquired pneumonia, akaongelea community acquired pneumonia, akaongelea pia causative pneumonia ambayo inakosewa na causative agents, ndio. So after that, so going to know what are some of the causes of pneumonia generally, ndio. Causes of pneumonia, like sasa, because understand the specific causes like hiyo ambayo umeongelea, viral, bacterial na fungal. So kama umeelewa causes nizo ameongelea, so you're going to know how, so Charles, how the, I just want to explain ili mtu ambaye kuna pneumonia ana present in what are some of the clinical manifestation, ile vitu ambayo ata present nazo, ambaye pia akiwa na hapo, kama naocha, akiwa na hii video, kama si relative wake ama friend or someone nearby him or neighbor wake, ajue person having pneumonia ana present with some of these clinical manifestations, ndio. So ningependa waambie how is it being presented.
Thank you so much. So, having said that it is a respiratory condition, so you will expect the signs to be confined, or rather, more signs will be in respiratory system. So, you realize that in respiratory system, we are so much concentrated in breathing. So, our patient will present with laborious breathing. Atakuwa na breathe na shida. Atakuwa
nasikia kana nalemewa na hewa.
Yes. And then they will be coughing. They'll be we have these terminologies. We have a term like hematemesis and hemoptysis. We have a normal cough.
So I just want to know, like, I just want to tell them what's like terms of cough.
Yes. So
there are different types of coughs.
True.
So what do you mean by saying hematemesis?
Now, hematemesis is basically when you cough and then the contents of the cough are, we have blood, right?
Like blood is sputum.
Yes. And then hematemesis is when you vomit blood.
Okay.
And then there is now the normal cough.
The dry cough.
Yeah, the dry cough. So our patient will either present with a dry cough, with hematemesis. We also present with chills. Chills is feeling very cold.
And also fever.
Yes, we have fever. We have rigors.
General malaise, like some mtu anasikia ni kama amechoka kabisa.
General malaise, exactly. Somebody amechoka sana. We also have dyspnea. But dyspnea is just the same as laborious breathing, difficulty in breathing. And then we have also
like weight loss, if I may say, weight loss fear.
Exactly, weight loss and such. Those are some of the signs or presentations.
So mtu akiwa, if you are watching this video and you have those some of the clinical, those signs and zenye ameongelea, signs and symptoms like labored breathing, upungufu wa kilo zako hivyo, dyspnea, alafu unapata pia mtu anakuwa na kikohozi either dry, maybe bloodish cough, pia ujue that sign of pneumonia. Then kuna joto kwa mwili, unapata joto limeenda juu kabisa. Then have chills, ndio.
True, the rigors.
Yeah. So after saying that, so tungependa tuende kwa like sasa mtu amepatikana kwa pneumonia, ndio. Amepresent those some of the clinical manifestations ambayo tumeongelea, ndio. So in case aende hospitali, would you mind that kuongelea some of the diagnosis ambayo akienda kusula atafanyiwa, expect kufanyiwa akiwa na pneumonia? So in case anaochi video, akienda huko si anyamaze like as if like ana knowledge about that pneumonia of which you're talking about. So ningependa angalia some of the diagnosis ambayo akienda kusula atafanyiwa.
True. Thank you so much. So diagnosis, first of all, when you go to hospital setup and maybe you present with the signs,
like so to say, but the first sign, unapata mtu atakuwa na shida kupumua kabisa.
Exactly.
So in case you have that sign, that's the primarily sign kabisa. So ukienda hospitali, so we want to know what some of the diagnosis.
Exactly. So the first thing I'll do as a clinician, so I'll first take a very comprehensive history, and of course we know the contents of history.
Kujua kama ni kusheni history ya familia.
Exactly. The comprehensive part of the history. And then I'll also do the physical examination. Physical examination, I will see the general appearance of the patient, how is he oriented in terms of time, place, person. I'll also go to general examination, whereby I'll be observing things like jaundice, cyanosis,
like some mtu akona blue color in there,
blue colors in extremities, and then edema, dehydration, and kukohoa, general examination. From there, I now go to systemic examination. Systemic examination, I'll be so much concentrated with respiratory system. So I'll be inspecting, I'll be, auscultating, palpating, and percussion. There's those terms that you get to be acclimatized with in the hospital setup. So
So
after taking those, yes,
like in auscultation utakuwa unatafuta nini like by doing auscultation?
yes.
And which instrument do you use?
Thank you so much. So we have a stethoscope. Stethoscope, we have parts like the diaphragm and the bell. So I'm so much interested at checking or listening to the sounds. So we have the normal chest sounds, we have the abnormal. We also check the heartbeats, and also because pneumonia presents with raised heartbeats, right?
But there in the clinical manifestation pia utapata mtu akona raised heartbeat kabisa inapigonga kwa haraka, mapigo ya moyo, si ndio?
And just by the way, the normal heartbeat or pulse rate should range from 60 to 100. When it is above 100, we are calling it tachycardia. When it is below 60, we call it bradycardia.
Bradycardia, so low heartbeat.
So I'll diagnose by auscultating from the second intercostal space up to the sixth intercostal space. So you realize that the heart, the apex of the heart is always in the fifth intercostal space. So I'll be auscultating for the heart sounds mostly. I'll also auscultate, for the breathing patterns. The airways,
like,
the trachea.
Mtu like anakona asymmetrical breathing.
Asymmetrical
like
breathing.
Side moja inaenda ingine inabaki, si ndio?
Inabaki. So such things. From there now, we go to the laboratory investigations. So we investigate for the phlebogram. Phlebogram, we check the contents of the blood cells.
So wanachukua blood as a sample alafu wanapima, si ndio?
Exactly. So one of them is the white blood cell. Remember, the microbes are entering into the lungs. So the body has to come up with the mechanism of defending itself against the microbes. So normally we have the levels of white blood cells being between 4,000 to 11,000 millimoles per liter. So you expect that patient, the white blood cell,
to indicate indication of infection.
Exactly, it will be raised to counter the effect of microbes. So we shall do the full hemogram, we shall do the blood gas, we shall also what else can we
creatinine
do?
Test.
Yeah, the creatinine and the electrolyte test. Yeah, such things.
Okay, thank you for that. So I just wanted to know what are some of the complication mtu akiwa na pneumonia na complicate. So in case akwa pneumonia ukose ku treat that pneumonia, what are some of the complications? That's in brief.
Yes, thank you so much. So one of them will be lung collapse. We shall have lung collapse.
Sapo lung haifanyi kazi kabisa.
Lung haifanyi kazi. So we shall,
bad kabisa.
Yes. And then we shall also have pneumothorax. Pneumothorax is basically the accumulation of the air in the lungs.
Accumulation of air.
And I don't know whether you can add some.
So okay, if I may add, kutakuwa na something called pleural effusion.
Yes.
Pleural effusion ni ambapo kuna fluid. So ile pneumothorax ni air in the
lungs.
In the lungs. But pleural effusion kutakuwa na fluid in the pleural space, ndio which mtu atafeel pia kama kuna pulmonary edema kabisa. Then utapata mtu akona shida acute respiratory failure, shida ya kupumua kabisa hivyo, si ndio? So if in case you have pneumonia and like ukose kuwa mzoefu wa kwenda hospitali, utapata kwamba una complicate some of the complication ambayo itafanya like itakupredispose sana kwa kifo, unaona? So what are some of the management, like nonpharmacological management, if we may start with that? Mtu ambaye kuna pneumonia anafaa kuwa anafanya hivyo, ama akienda hospitali atafanywa vitu kama hiyo, what him or her anaenda ku expect?
Thank you so much. So for management of pneumonia, we have pharmacological and non-pharmacological management. So pharmacological management is administering drugs, kupea dawa mgonjwa. Non-pharmacological is something else apart from the drugs. So when we now come to so you can give something like doxycycline, you can give like erythromycin. Doses vary depending on some other parameters like age, body weight and such. For viral pneumonia that is caused by viruses, you can give drugs, viral drugs, antivirals. So we can have drugs like oseltamivir, we can have drugs like saquinavir, such antiviral drugs. Then we also have the antifungal drugs. So we have something like capsofungin, mecafungin, griseofulvin,
the antifungals.
Yeah.
Okay, so that's the management mtu akiwa na pneumonia kabisa. After we're going to know what are some of the prevention to the community, sindio? Like mtu akiwa like since we are doing health talk, what can you tell the person ambaye akona pneumonia, ama how can you be prevented from acquiring that pneumonia? So I just wanted to health educate them in terms of prevention.
True. Thank you so much. So for preventing pneumonia, I'll advise the community to avoid smoking, because smoking predisposes to pneumonia in one way or another. So
mtu azuie
kufuta sigara, because sigara ina clear remember kwa trachea we have the cilia or the air that wafts microbes outwards and also filters in air. So if for the case of smoke, it clears the air. So it means the microbes will have a direct entry to the lungs. So and pneumonia progresses. Again, I will also advise people to conform to healthy lifestyle. Healthy lifestyles. Washing hands after you anything after toilet, when you come with maybe contact with dirty surfaces.
Then if I may say, like pia mtu those endemic areas,
exactly,
areas zimejaa pneumonia, sikuwa naenda kuvisit those areas.
Exactly. Yes. You also avoid the endemic areas of pneumonia. And then lastly, we have vaccination. There is what you call the pentavalent vaccine for pneumonia. So you advise the community to get the vaccine, and then those are basically the control measures of pneumonia.
So guys, in case you have watched this video, remember to subscribe, like and share and comment down in the comment section. Today I brought this guy, man, he's content oriented kabisa, and a lot more is coming. There's a lot new videos the ambazo zinakuja. This Charles, in case you don't know his name, ni Charles, amesema ni Charles. So we are going to do a lot more video with him, because I believe that you are going to get empowered and educated. Bye bye, let's meet on the next video.